Hi, everyone. I'm here today to talk about something that is super common in primary care. So it's a pattern I've seen again and again over my years of practice. Patients are told their labs are normal. Their exam is reassuring. Nothing's really wrong. Yet something doesn't feel right. I'll give you a recent example. A good friend and I, we were having pizza and wine last week, decompressing after what felt like the 100th snow day. Our kids were running circles around us, and she pulled up a message from her primary care doc that had come through the portal after her recent physical. Her labs had been reviewed, and the message said, "Your cholesterol's a little high, but overall everything looks good. See you next year." She looked at me and said, "What do I do with this?" And honestly, this stuck with me. It's a good question, and it's really common. I'll also say this openly. As a doc, I know I've sent messages like that in the past to patients. Traditional medicine does a lot of things really well. We are really good at treating acute illness, we can manage chronic diseases, and we follow evidence-based guidelines developed for large populations of people. But where traditional medicine really struggles is the gray zone, that space between healthy and sick, where kind of that early risk lives. And it's where little things can start to show up that if we're just looking at large populations and evidence-based guidelines, we can miss it. And this is where we can do better. This is where the idea of personalized, proactive medicine becomes important. For my friend, this doesn't mean she needs to panic. It doesn't necessarily mean she needs aggressive treatment. It just means asking better questions. What does her cholesterol mean in the context of her overall cardiovascular risk? Does she have a family history of heart disease? Is anyone in her family on a statin? Would more detailed lipid testing help clarify her long-term risk? Checking something like Lp(a) or apolipoprotein B. And most importantly, what is the right plan for her? What are her goals? What is she most worried about? Care shouldn't be based on averages alone. It should be based on the person sitting in front of you. So on the other end of the spectrum, personalized, precision-based care is often misunderstood. It's not about ordering 205 blood tests. It's not about chasing perfect numbers. And it's not about optimizing just to say you're optimized. It's really about context. It's about your personal medical history. It's about your personal physiology, your family's health, and patterns over time. It's not just a single snapshot. And this way of thinking is why I'm choosing to practice primary care differently. As I build my new practice, I'm excited to care for patients in this different, more thoughtful way. With more time, I can really dig into the details. I can look for patterns across years and help create plans that are really personalized and aligned with each patient and their goals. If you've ever been told that everything looks fine, but still feel uncertain, this conversation's for you. I'll be sharing more about what proactive, personalized primary care looks like and how I'm approaching it differently going forward. Thanks for being here, and I'm excited for what's ahead.